Hi, my name is Maria Diaz Vasquez, and I'm talking to you about my capstone project. I decided to do my capstone project about how hormonal fluctuation can directly influence a woman's cognitive and emotional state, especially in the menstrual cycle. The agenda for today, I'm going to talk to you about a little bit about the research topic. I'm going to explain a little bit of background information about the topic, my hypothesis, method that I use for the research, results, discussion, some limitation, and personal reflection. The purpose of this research is to identify if there's any relation between the change of hormonal changes during the menstrual cycle and how it can alter a woman's mood and even cognition. Hormones are an essential part of our body and they help our body function properly. However, some women can be more sensitive to hormonal fluctuation during the menstrual cycle, which can interfere with their daily activities and even create a sense of discomfort. This hormonal change can lead women to experience physical and psychological symptoms, and the purpose of this research is to inform the different types of hormones that are essential to a woman's cycle and identify how each hormone affects a specific part of the brain. The intention is identify each hormone is to provide a general idea of what each hormone becomes present and how to identify if there's a possible alternative to decrease discomfort when there come imbalance. A woman may experience several changes when before a period arrives. It can be physical and even emotional. That it calls PMS, what is like premenstrual syndrome, which is like a several symptoms such as mood change, bloating, physical pain, back pain, headache, all the symptoms that usually occur before our menstrual periods start. However, some women can suffer from a predisposition to be sensitive to hormonal changes. This can have an intolerance to drop on one specific hormone, and it can increase in another one. This causes experience several psychological symptoms and physical symptoms. Some of those are anxiety, persistent anger, irritability, lack of motivation, depressive moods, and even withdrawal from social settings. This is known as dysphoric disorder, or mostly called PMDD. This condition has always been around. However, it has been recognized by the mental field and has been established DN5 as a mental disorder recently, only in 2013. This has led women from suffering negative stigma and stereotype during when they are on this period of mood change and um, discomfort, physical discomfort. This misinformation and lack of understanding of this change in hormone led women to experience some stereotypes and stigma during their menstrual cycle. What causes women's behavior is more than a stigma. It's just biochemical changes that occurs inside the bodies. So now I'm going to break down a little bit and give more information about the menstrual cycle. So I'm going to explain you a little bit about the two phases, the subphases, the pre-ovulation phase and the post-ovulation phase. So in the pre-ovulation phase is the subphase defined as follicular phase, which begins in the hypothalamus and sends the signal to produce a sex hormone, FSG hormone. During this phase, the body experiences increased estrogen produced by follicles. These follicles are responsible for preparing and continuing the fluid that helps mature the egg, preparing it for fertilization. Previous research has shown that during this follicular phase, during the menstrual cycle, when estrogen levels are high, women tend to experience increase in energy levels, improved focus, and overall sense of feeling their best. This energy boost can help them accomplish complex tasks, increase their strength, and feel generally better. High estrogen levels are being associated with better focus and physical strength. The study compared the brain connectivity on pre-ovulation phase and post-ovulation phase, and research have found that the brain nodes connect differently in each phase. During the pre-ovulatory phase, there has been a strong connective and activation of the brain in the frontal lobe area. This indicates that during this time, women may be more substantial cognitive process, better decision making, and enhance the capacity to learn and compared to the post-ovulation phase. On the post-ovulation phase is a change in hormones. Again, the level of estrogen decreases during this phase. The level of progesterone increases. This hormone facilitates the change of the endometrium, which prepares the area of possible fertilization in the egg to improve the chances of survival. The luteal phase is a crucial period in women's menstrual cycle, during which the body undergoes the physical preparation for possible pregnancy. This phase caused by surge of hormone, progesterone, which can affect the body and mind. As progesterone level rises in the body, women may feel bloated, experience reduced energy level. In this stage, those who suffer from severe psychological symptoms, such as PMDD, can have the severe symptoms of their disorder. Some women may feel more overwhelmed by the daily activities and can feel uncomfortable comparing them compared to pre-ovulation phase. They may also experience some brain fog as a common symptom during this phase. It can also be difficult to concentrate and stay focused. The brain nodes changes, so the frontal nodes become less active, and then the thalamic connectivity started to increase. This leads women to become more vulnerable, more sensitive during this phase, especially in the luteal phase. So the hypothesis for my research is to see how hormonal changes during the menstrual cycle may impact cognitive function and emotional state. It is prognostic that women may experience more psychological symptoms, mood swing, anxiety, and lack of concentration, especially 2 weeks prior the menstrual cycle, especially in the luteal phase. To get a little insight about how hormonal fluctuation may affect a woman's cognition and emotional state, I asked several questions about physical and psychological symptoms that women experience. So I did a survey in Google form, and they were able to answer, I believe, 20 questions regarding their menstrual cycle, like psychological symptom, physical symptom, and where they feel it. It was like if they experience anxiety, lack of motivation, it had the sleep problems, if they feel bloated, headache, and any other discomfort, and they were also allowed to report if they have been the official diagnostic with a mental disorder or a premenstrual disorder or other related disorder they would like to report. Some of the results were that 81% of the participant in this case was around 21 people that answered the surveys. They experienced psychological symptoms. Most of the psychological symptoms they reported was lack of motivation, followed by anger or rage, and following anxiety. There was only 14% of brain fog, and only this entire 14% did not experience any change. So it was very important to know when they were experiencing this type of symptoms. 38% reported to experience 1 to 2 weeks prior the menstrual cycle rise. This is the post-ovulatory phase, which is the luteal phase that I suspected to have the most impact on emotional state and physical state. So overall, yes, it can be concluded there's a little bit of a correlation about how hormonal fluctuation change and how they affect a woman's cognition and emotional state. As it was hypothesized, it was expected those changes to be occurred 2 weeks prior the menstrual period arrives. In the case if the person has more severe symptoms, those symptoms may be severe or increase their severity during those phases, such as a woman that experienced PMDD. To have a more insight, it will be ideal to do more research on women that do a PMDD. For that, we need a specific permits to do so. To alleviate the symptoms, it's recommended to use nutrition balanced diet. Also to follow your menstrual cycle, like counting the 28 days, so you can track as it calls a menstrual diary, and also daily exercise. And in the signs of anxiety or depression moods or symptoms, it is suggested to use cognitive behavior therapy so you can manage and direct those negative emotions to a more positive way during those days. The only limitation I can say about this doing this project, it was the time frame. This is a topic that is very passionate of mine. I really enjoy doing this research. I would like to have more time to get to more deep and interviews with the participants, ask questions in depth. With 6 weeks, it was a little hard to get that information. Also, the sample was a little bit small, so it will be ideal to be bigger so we can get more input, and also to ask the question to participant that has PMDD or premenstrual disorder related syndromes. So my personal reflection doing this capstone project, it made me realize I'm really into women's health, especially mental health. In the future, I would like to become a licensed counselor. I would like to pursue my master's degree, and in the meanwhile I'm doing that, I would like to get my health coach certification. However, I'm going to take some time off to focus on my family's needs. It's been a while, doing this long process, getting my degree, so I'm going to dedicate some time to them. But after my break, I would like to pursue my master in clinical mental health counseling. I will then take a NCCE and complete the required supervised hours so I can get my LPC certification and become a licensed counselor. So overall, that's my plan for the future. I hope you guys like my presentation and learn about it and enjoy. Thank you and have a good night.